The Department of State Services says it has uncovered a plot by suspected criminal gangs to attack worship and relaxation centers in parts of the country with improvised explosive devices. A statement by the Public Relations Officer, Peter Afunaya, also explains that the objective is to launch further attacks on critical infrastructure and other public places frequently visited. Mr. Afunanya warned managers and owners of worship and relaxation centers to be cautious and implement basic security measures to deter the threats. The DSS assured that although the plans are aimed at putting fear in the minds of Nigerians, its officials would continue to disrupt the trend and pattern of violent attacks. Meanwhile, suspected terrorists have released pictures of some kidnapped victims believed to be persons abducted during the train attack incident last month. In the first photograph, at least 17 men could be identified. In the second photo, at least 18 women could be seen together with 5 children. This is the third time in 4 weeks the terrorists will release pictures or videos of their captives. The kidnapped victims have now spent at least 29 days in an unknown location with their captors, despite repeated calls on the government and security agencies to secure their freedom. The latest pictures come barely a month after the government confirmed that at least 8 people died, 26 others sustained injuries, with an unspecified number of persons abducted during the deadly attack. And still talking security, police in Zamfara state have described the killing of a popular vigilante commander, Dan Mudi Mada, and 6 other members of the group by armed bandits as a reprisal attack. They also say the attack on Magazu community that led to the abduction of 24 persons on Monday night was as a result of the killing of a 15-year-old cattle rearer by the locals. Theophilus Darafai reports.
Mada is a community in Gusau local government area of Zamfara state. The community was attacked by armed bandits Sunday night, and 7 persons were killed, including a popular vigilante group leader, Damudi Mada. The attack has been described by the police as a reprisal after the local vigilante group attacked bandits' hideouts in the area. Speaking to TVC News Crew, spokesperson of the Zamfara Police Command says those killed were members of the local vigilante group keeping watch on their community. He says they were ambushed by the bandits.
4 were killed during the ambush. 3 were kidnapped by the bandits, and then thereafter they killed them while in captivity. So the police and the military, like I said, are receiving the information, swung into action.
The police also confirmed the attack and abduction of persons in Magazu community. It was also as a result of the killing of a 15-year-old cattle rearer by the locals.
There was an abduction in that Magazu, and a preliminary investigation revealed that the incident was a reprisal one, following the killing of a Fulani boy some days ago. And that was why the community was attacked.
Police authorities in Zamfara says joint security operatives had on Tuesday morning repelled bandits' attack on Gora community in Bakura local government area and Ruambaure in Gusau local government area. Incessant attacks and kidnapping for ransom has forced many villages to set up vigilante groups to protect their communities from attacks by bandits. But it seems the development has worsened security challenges, giving rise to reprisal killings between the bandits and the locals. Theophilus Darafai, TVC News, Gusau.
And here in Lagos, the police command has promised to bring to book the police officer who allegedly shot indiscriminately and killed 2 persons at a party. After the Sunday's incident, the officer is said to be on the run, and senior correspondent Ivy Kanu reports.
This is Chikere Obiechi, popularly known as JB, and Igwe Odinaka, 2 businessmen united by fate. Sunday the 24th of April started like every other day for them, not knowing that disaster lurks at their doorstep. They were invited to a friend's birthday party at a bar in Idimo. As they partied, out of the blues, gunshots rained, and the once bubbly party turned gloomy. This left 2 people dead and 1 seriously wounded. A visit to the scene on Tuesday showed a deserted bar. We are here at Computer Village. We are trying to get to speak with the management of this market to find out what they intend to do about this sad incident. At Computer Village, where the 2 felled by the bullets had shops, a representative of the market, while taking us round, described their death as unfortunate.
They are very nice people. Mr. Chikere, that's JB, popularly known as JB. He's a very wonderful human being that you can never fault him for anything. And very peaceful, very down to earth, and very helpful to everybody in this market. We miss 2 of them as our members.
He called on the police to investigate what really happened.
The market is asking for justice for our member, for the government to also ensure that most of these police people don't go for illegal duties again, because I understand that was not an official duty from the policeman, and that the policeman should be apprehended.
Meanwhile, police say efforts are in top gear to arrest the fleeing police officer. They stress that the police officer attended the party based on his relationship with the celebrant. As the search continues, the celebrant is also on the run as at the time of filing this report. Ivy Kano, TVC News, Lagos.
World Immunization Week, celebrated in the last week of April, aims to highlight the collective action needed and to promote the use of vaccines to protect people of all ages against disease. The World Health Organization works with countries across the globe to raise awareness of the value of vaccines and immunization, and ensures that governments obtain the necessary guidance and technical support to implement high-quality immunization programs. The ultimate goal of World Immunization Week is for more people and their communities to be protected from vaccine-preventable diseases. And joining me now to shed more light about this week is Health Manager UNICEF, Dr. Clement Adams. Good to have you join us, Dr. Adams.
Thanks very much, and thanks to all your listeners.
So when it comes to immunization, I think so far, our biggest success is in terms of polio. We have successfully eradicated polio in the country. We have been declared free. But talk to us about where we are in terms of ensuring that people are vaccinated against preventable diseases in the country.
Thank you very much, and thanks to your listeners. At the moment, efforts are being done jointly by WHO, UNICEF, other partners in partnership with the National Primary Healthcare and the state primary healthcare to ensure that we are able to reach all communities and reach all children to immunize them. Over the years, we've been progressing. The progress has been going on very steadily. However, we do acknowledge the fact that we are not to the optimal level that we desire to be, but there's been progress, and the progress has been quite remarkable in the past few years. As you know, we have been able to eradicate wild polio virus. And of course, we have also been able to ensure that a lot of children are immunized against measles and other diseases as well. So there's been progress that we've been making over the years.
And what are the biggest areas of challenges? If you can hear me, Dr. Adams, I'm asking the areas of challenges.
Thanks very much. The biggest areas of challenges has to do with how to be able to reach all communities. We do have some communities that are very hard to reach, and so it is quite difficult, and the terrains are quite challenging on how to reach these communities. This is one of the challenges. In some areas, for example, in the northeast and the northwest, we also do face these challenges of the insurgency that makes that some of the communities are cut off from us, and we are not able to reach them as we should be reaching them monthly. And of course, we also require some level of funding to ensure that optimum uptake of services is improved. So community mobilization activities and community sensitization activities needs to be at the optimum. And these are some of the challenges that we face, that we are not able to reach everybody. And of course, we have cultural norms, we have vaccine hesitancy from people, and we have traditional issues that are also bedeviling us as we try to change people's behavior towards vaccines.
Absolutely. Culture has played a huge role. And I also imagine that with the several misinformation concerning the COVID-19 vaccine, that it will spiral out of control in terms of other vaccines. But let's talk about insurgency, because I imagine that to be a big challenge and the areas that you cannot reach. So what sort of collective effort would you require to ensure that those people in those areas or children in those areas are vaccinated?
Thanks very much. And it's a collaborative effort, and we've been doing that over the years. It's a collaborative effort between all partners, WHO, UNICEF, other NGOs. It also involved the state primary health care of those specific states, specifically in Borno, Yobe, Adamawa, Sokoto, Zamfara, and the rest where we have the challenges. But it also involved us also working collaboratively with the civilian JTF and also with the military. That will ensure that we are able to they are able to help us out to get access into these places. And it also involves us working with the community leaders, the Pulamas and what have you, to ensure that we are together, we all come together to see how best we are able to get these children to immunize. So those are some of the strategies we've been using in trying to reach these children.
And I guess we have to continue to put the word out there how important immunization and vaccination is, especially in preventing diseases. Thank you so much for talking to us. The health manager, UNICEF, Dr. Clement Adams.